My name is Dr. Cook, and I'm presenting on behalf of colleagues that I've worked with on a project on journal clubs at the Chartered College of Teaching. Dr. Lisa Maria Muller, who's helped with the research, and Beth O'Brien, who led and facilitated the journal club project. So briefly today, I'm going to be talking about why journal clubs, an introduction to the research and an outline of some of our key findings. But in particular, if we start to think about journal clubs and why we chose this model, we'll see that the history of journal clubs can be traced to medical education, the early 1900s in Germany. And actually, amidst a drive for more research use amongst teachers in England, they've been increasingly adapted and developed for use within education. And we situate this within the mechanisms of learning in professional communities. So the work of Sims and colleagues looking at the core mechanisms within journal clubs that help to ensure effective professional development. So links to high quality research, opportunities for peer learning, a clear link to practice and taking place over an extended period of time. But of course, dialogue is also of central importance to journal clubs. So if we look at studies exploring the role of talk in lesson study, that research tends to focus on teachers talking together in professional communities, and as yet interprofessional dialogue between teachers and TAs is currently unexplored in the literature. But a recent EEF report identified effective collaboration between teachers and TAs as one of 5 key recommendations to improve provision for students with special educational needs and diversity. So there's clear need for a project of this nature. So briefly then, the journal club cycle starts with the very first journal club would start with a new article, which is summarised using a critical appraisal tool, which I'll introduce in a moment. And then some implementation planning will take place using another tool where the findings of the research and their implications for practice are discussed and decided upon to really develop an action plan. And then over the 4-week cycle through which journal clubs are implemented, teachers and TAs have time to go away and implement what they've found from the research in their setting. And then coming 4 weeks later to the next journal club, that begins with reflection on that implementation. And then they move on to the second article. And so the cycle continues. So the critical appraisal tool that I mentioned has been developed from existing critical appraisal tools used in healthcare, and it covers 3 main areas: validity, trustworthiness, and relevance. And we also developed a classroom implementation planning tool at the college, which is very much designed to guide and develop plans around effectiveness. Now, at the Chartered College of Teaching, we recognise the crucial role that expert teachers and TAs play in the process of adapting and implementing research evidence in the classroom. We do not see this as a top-down process. So the field of education has frequently been compared to the field of medicine, in particular biomedicine, which has led to a sort of top-down evidence-based practice understanding and the view of RCTs as the gold standard for research education. But actually, critics would argue that education is far more complex and interdisciplinary than that. And actually, it might be more favourably compared to the field of mental health care. And actually, that view aligns very much with our view of the college, which is a bottom-up understanding of evidence-informed practice. And for us, this involves the intersection, as you can see here on this diagram, between the best available research evidence, teacher expertise, experience and professional judgment, and the context from the macro down to the micro. And it's really at that intersection of those 3 things that we think evidence-informed practice happens. Within this presentation today, I'm going to draw on some recent work that we've done at the colleagues on professionalism. And with my colleague, Lisa Maria, we have authored a report. It's very much a working paper on definition of professionalism, which has involved adapting MES's 2002 definition to create what we can see here. Now, this looks at 3 complex sort of overlapping aspects of professionalism: the cognitive, the ethical, and the legal and social domains. And I'm not going to dwell on every aspect of this diagram, but what I am going to do is look at the intersection of the cognitive and the ethical domain today. So where we see collaboration and engagement with research, I think what this research with journal clubs has really done has really helped us to elaborate the nuance and complexity around that interaction with research. And that will become clear as the presentation progresses. So the aims of the research then were threefold. To think about how engagement with research and journal clubs help teachers and TAs to develop their pedagogical intentions to support students with SEND. To actually think about the dialogic mechanisms in journal clubs that promote engagement with research, and to think about how journal clubs can encourage critical reflection on research implementation. Now, the case study that I'm going to draw upon today focuses on one secondary school situated in the west of England. This is a non-selective mixed academy, has a cohort of almost 1,000 students from the ages of 11 to 16 years. The school is very diverse, caters for a range of needs, and the number of students eligible for free school meals and with diagnosed SEND far exceeds the national average. And in this school, all 6 journal clubs were hosted in school and scheduled for the same time and day in the first week of the month. Meetings were incorporated into staff's directed time for professional development. And there's also a training programme at the beginning of the journal club course for both participants and facilitators. The facilitator is also a participant in the course, but they have an extra responsibility for facilitating each journal club session. And that staff training was also designated to be completed within school time as part of an inset day. And that setup in this particular school was particularly important because it did mean that attrition, compared to the other studies where perhaps it was relying more on goodwill and scheduling was not necessarily as regular, and it certainly wasn't part of directed time, the attrition rate in those studies was much higher. But this careful planning in this study really meant that the group continued to meet throughout the 6 months, 6 journal clubs that form part of the data set. Methodologically, I'm not going to go into too much detail here, but the dialogue analysis that I've focused on comes from a particular sort of field associated with the systematically established levels of analysis. So here we can see that communicative acts at the micro level are embedded within communicative events at the meso level, which in turn is embedded within communicative situation at the macro level. Now, Sarah Hennessy and colleagues working at the University of Cambridge would describe a communicative event as a series of turns in a conversation defined by a clear beginning and an end, such as a change of topic. So I did a CE level analysis to identify the number of episodes in the data set across all 6 journal clubs. And I identified 34 different episodes. And within those episodes, I was able to then dig down into the communicative act level of analysis. And that involved coding on a turn-by-turn basis using a particular dialogue coding scheme that was originally adapted from the Scheme for Educational Dialogue Analysis by Hennessy and colleagues. That in turn has been adapted to the Cambridge Dialogue Analysis Scheme, CDAS, and the dialogue coding scheme that I used was actually an adapted version of both of those, something that I'd used before on a previous project. And that was really useful for focusing in on the critical aspect of the dialogue that was evident in teachers and TAs contributions. So these are the main codes that I was looking for, and in conjunction with my colleague Lisa Maria, we completed intercoder agreement, and binary coding was completed on a turn-by-turn basis. So I was looking for inviting elaboration, so where you build on and elaborate your own or someone else's contribution, and where you invite that, and then elaboration where you actually do build on or elaborate. Inviting reasoning, where you explicitly invite explanation, justification of a contribution or speculation, prediction or hypothesis. Reasoning, where you provide then explanation or justification of a contribution. Querying, where you doubt, fully or partially disagree, challenge or reject a statement. And then we also coded for coordination, but this wasn't as evident within the overall data set, hence why we couldn't calculate intercoder agreement for this. So on to the main findings then. First of all, I think when we're talking about evidence-informed practice, often we might think about the public understanding of science. So this focuses on methodological soundness, up-to-date findings and practical importance. So the extract I'm going to show you now comes from the first journal club, in the case study school that I discussed previously, where participants were discussing an article exploring how children with SEND perceive and experience retrieval practice in mathematics. It's a qualitative piece of research. It focused on 6 children in year 5, that's 9 to 10 years, and it explored the perceived benefits of retrieval practice for students learning their multiplication tables and whether those students experienced it as a low-stakes strategy. So here we can see that the extract begins with a TA stating that that context that I just described, qualitative research with 6 children in year 5, is completely different to their context in secondary school. But then another TA actually challenges that idea and says that they don't necessarily agree with it. I mean, I agree it's small, but I don't think it's necessarily different in terms of the kids. I think it applies equally to our kids quizzing and feeling anxious around these tests. I mean, we see that all the time. And then that same TA goes on to explain, using evidence from professional practice, about a student last year we had to remove from lessons for every quiz and test because she was so anxious about them. Anyways, I think in terms of identity around particularly maths and quizzing is quite strong across all age groups, really. So here we can see a critical discussion of population validity that's very much associated with the public understanding of science. And we've got a creative and supportive dialogic space that's evident through the verbal and non-verbal supportive moves, the hms and the noddings and the yes, helps to create that space where criticality and challenge is accepted and welcomed. So the criticality is evident from the querying and the reasoning in the second TA's contribution. But if we want to move on from public understanding of science to really develop our understanding around the nuance around what we mean by evidence-informed practice, we can actually start to move on to this idea of ethical reflection. And Erikson actually explores how professionals such as doctors and teachers translate research into practice by filtering it through 3 different sensitivities. And one of those sensitivities that Erikson writes about is practice sensitivity. And that clearly sits at the intersection of the ethical and the cognitive domain if we return to our working definition of professionalism. According to Erikson, practice sensitivity relates to teachers' collective ethical reflections on research evidence, and it can actually lead to teachers resisting an intervention if it goes against their moral commitments. And actually what we've got here is some empirical evidence of this happening in practice. So this particular example I'm going to show you shows how one particular teaching assistant thinks that teachers' retrieval practice should be adapted so as to better meet the needs of student with SEND. So the TA states, I know why teachers do it because they want to know how they are doing, but you know, who got 6? And you've got all those who put their hands up, but then you've got those SEN kids who probably got 1 or 2, but they haven't got 1 or 2 out of 6. They got 1 or 2 out of 1 or 2. So instead of asking them how many they've got, who got all the questions they answered right? Because you're not putting a number to it. And again, we can see here how reasoning was happening with the because and the challenge through the but through the lens of practice sensitivity, and how this particular TA is engaging in ethical reflection as they are developing their pedagogic intentions, and they're actually justifying the adaptation of retrieval practice in response to the profession's publicly recognised role, commitments to dignity. So they're really refusing to follow mechanical rule following, and this connection of research with practice is therefore really quite complex and demonstrates the importance of professional expertise and context. So in conclusion then, these findings have really helped to tweak out and tweeze out the nuance of integrating research and professional judgment. Crucially, all members of the Journal Club were positioned as experts who contributed to the discussion. There wasn't a power dynamic evident in the data between TAs and teachers. So actually this does clearly seem to indicate that the Journal Club is a potentially useful process to explore the potential of realising the TA workforce as part of a wider, more inclusive approach to students with SEND, very much in line with the EEF recommendations that were discussed earlier. But as I said, that comes with a caveat of the fact that this particular case study, attrition was low because it was very much engaged. Participant engagement was maximised through careful planning. In those journal clubs that weren't set up in the same way, attrition was much higher. So I think that's an important caveat that we need to be aware of. But crucially, the Journal Club process helped to create a safe dialogic space in which participants were able to reconcile evidence-based practice and practical wisdom through critical but also responsible engagement with research. And actually, therefore, we would argue that professionalism includes the autonomy to make decisions based on context and an ethical framework. And I think what this study really does is highlight the active role that teachers and teaching assistants play in interpreting and applying research evidence according to their context, taking those ethical dimensions into consideration. And it also helps to highlight how teachers develop critical research engagement skills through professional dialogue and collaboration. In terms of future developments, we think it's important to encourage teachers in the critical appraisal tool to think about appropriateness of their findings for their specific context. We also are going to develop the facilitator training that we implement at the start of the course to really ensure that there's a clearer focus on dialogue within that. Because some of the reflections around implementation weren't as dialogic as the critical engagement with the research. And we also think it's really useful to identify case pupils, because TAs were able to focus their observations more clearly on specific groups of students, whereas teachers perhaps might have struggled slightly more with that because they're looking at a class of 30. So actually, in lesson study, it's common practice to identify case pupils, and we think this is especially important within journal clubs as well for teachers working with whole classes. Thank you very much for listening.